In the heart of Silicon Valley, there is a remarkable store. Eternal Beauty is located in Cupertino, very near the world headquarters for Apple Computer. Eternal Beauty is dedicated to making you look your best by providing a host of services and products for that purpose. It is run by Jennylyn, who is herself an example of what the store strives to offer. Jennylyn is also a producer with a local community TV station. Today she interviews a plastic surgeon, Kirk, Churukian. The subject for today, breast implantation and blepharoplasty, or eyelid lift.
You're watching the Jennylyn Show, and I am Jennylyn, your host. And today I have another fascinating guest for you, one of Bay Area's finest plastic surgeons. And today I have selected two topics to discuss that lots of people seem to have questions for. And I decided to invite this great doctor who has graciously consented to come and answer those questions for you. So Dr. Churukian, Dr. Kirk Churukian, thank you so much for coming to my show.
Thank you, Jennylyn. You were most generous in your praise. Excited to be here, excited to talk about a lot of interesting things with you. As you know, these are a couple of my favorite topics, so happy again to be here.
Well, I was going to start you off by working you very hard.
Well, let's get to it.
I thought we could start off with breast augmentation. I have lots of friends who are interested, and a lot of people are scared because you hear so many stories about why you shouldn't do it. So I thought we could debunk a lot of the myths, and I'm going to ask as many questions as I can that will give people the general knowledge they need to feel safe enough to at least come and see you if this is something they want to do. So why don't we start off with what is breast augmentation?
Okay, well, it's it's a real great icebreaker, if you will. I get asked that a lot at cocktail parties. But breast augmentation is really it's about harmonizing your form. When you look at people and you think they're attractive, they have a very balanced shape and form. Their hips and their bust kind of line up. And so really what breast augmentation does is it helps to balance people out. Typically the people that I see are people who have very little breast tissue. And so oftentimes if they've got wide hips, they're going to have a very pear-shaped figure. If they don't have wide hips, they're going to look very immature. So a lot of times breast augmentation not only balances their figure, but it also feminizes them. They come in that I look like a young boy, right? Is the common retort. So putting breasts in, or at least defining the bust, gives them sort of more of a feminization, which people like.
So who is a good candidate for breast augmentation? Best candidate?
The best candidates are people who really self-select themselves out. So if you look in the mirror and you're wishing that your breasts were a little larger, if you're feeling a little self-conscious about the way you look in your clothes, then you're probably a reasonable candidate. I oftentimes tell people breast implants are like fashion accessories. If you should have the same feeling, with breast implants that you have when you feel like you're really dressed well. So it's that self-confidence, it's that ability to go forward and not worry about how you look, really.
And also to fit in your clothes. Because I know some people that they're so tiny that the smaller size is still bigger on the bust line.
Oh, exactly. So, when you fit into your clothes well, when you look good in clothes, you just feel good in general.
Yes. So how many types of breast implants are available today?
Well, there is a lot of new implants coming out on the market.
Okay.
For your audience, I'll break it down so that people can understand it. Basically, the big divide is between silicone and saline. And so 10 years ago, we were doing 95% saline implants. Now we're doing 95% gel implants. So if you get past that, most people are going to gel. Then you can break it down into smooth implants and textured implants. I like to use smooth implants in patients who maybe have real thin tissue where we need the tissue to, or the implant to grab a little bit and stay in a stable position. And then you can go from there to shaped, round, high profile round. The shaped implants are better for patients who really need more shape to their breast, who don't really have much breast tissue. If you've got a lot of breast tissue and you just need volume, the round implants are a real nice solution for those folks.
And why do you think more people are going with the gel?
Well, I think one of the biggest reasons that people went with saline was that gel was such a difficult medium to work with. The gel was really sticky and gooey, and if the implant broke, it was a mess to clean up. So the implant manufacturers did something really smart. They basically just made the gel thicker, so it's less viscous, it's more solid than liquid. So now if you get a break in the implant capsule,
Yes.
it just kind of bulges out. Okay. Now they've taken that a step further with the so-called gummy bear implants.
Yes.
The gummy bear implants are essentially a solid implant. So if you cut those in half, you'll have two halves that look like essentially, a gummy bear. So if those break, there's no flow out. And really what that does is it makes the exchange of implants down the road much simpler, much cleaner, and you don't have a lot of those issues that implants were really dinged for,
Right.
Especially back in the early 90s when people started to complain that implants were making them sick. Subsequent research proved that the implants weren't at fault, but it was sort of, a hassle with cleaning them out and having the issues with the breast hardening. So with a very simple maneuver, the implant companies have really minimized that risk going forward in the new style implants.
When it disintegrates or it pops, with the saline, it just gets reabsorbed by the body. Is that
Right,
correct?
it simply deflates.
Right. But with the gels, what type of damage can it cause to the breast tissue if it ruptures?
Well, nowadays it doesn't really cause much.
Okay.
There might be a little inflammation, a little bit of thickening with the tissue around that implant. But at this point in time, and we're still sort of waiting for the long-term implants that have been recently used to kind of give us some idea of how these are going to act, because they're relatively new. But in general, what we're feeling is that we're going to have less issues with contracture, we're going to have less issues with spilled gel within the cavity, and the implant change is going to be much quicker and therefore less expensive for the patients.
What would typically cause one of those implants to disintegrate while it's in the body?
Well, usually fold fractures are typically what we see in implant shell fractures. Now, of course, there's trauma. I've seen people after automobile accidents with ruptured implants, but in general, the implants are really strong. You can get them punctured with sharp objects, but in general, most people can do any athletic activity, any activity they want, and the implants don't get in the way.
Well, we want to also discuss the eye lift. So I don't want to suspend our whole interview doing this, but there's so many questions associated. So what would make someone would not qualify for a particular implant? Is there anything at all that would disqualify you from using one or the other, or making you a bad candidate?
You can certainly use whatever implant you want, but really what a smart surgeon does is we take these implants and we use them to kind of supplement what the breast is lacking. So if the breast is completely flat and you want to add shape to it, we'll use a shaped implant. Okay.
And this is a gel implant.
This is a gel. This is the so-called gummy bear implant.
Ah, this is what it looks like.
If they've got good shape and they've just lost some volume, say with childbearing, weight loss, things of
Yes.
that nature, or they just want larger breasts in general, then, a round implant, either in its smooth contour or a textured contour, are actually a very nice solution.
So which one is the saline?
So there's no saline on this tray here.
No.
Simply because most of our patients now are really opting for a more natural texture that the gel presents.
So the gel comes in a smooth surface as well. And this would typically go on a small frame or a big frame woman?
Well, it depends how big they want to be,
Okay.
how large they are to begin with,
Yes.
and how large their chest wall is. So every implant is different on every woman. So that's sort of the art of trying to size and choose an implant that's going to work well with each patient. The other concept that we try and communicate to patients is that really you have to be careful with size. So most of the complications that occur with breast implants are usually due to size, and that is malpositioning, where the implant is too low or too far to one side, loss of sensitivity, where the nerves get overstretched. So most of those complications come from an implant that's too big. And the way I explain it to people is that your body is going to push hard against something that deforms it significantly. And the less the deformation, the less the body is going to push back against it. The bigger the implant, the more it deforms the body, the more you're going to see the body push against it, and you could end up with scar tissue formation. You could end up with that implant moving into positions that you didn't really anticipate. So a lot of what we counsel patients to do is really to choose an implant that's going to work with their body, that's going to fit them, and also balance with the rest of their physique. So, I tell patients, if you pick an implant that works well with the rest of your body, it's going to look very natural. If you pick one that's too large for your body, people's eyes are going to move towards your chest.
But there are some women that's what they want.
Well, and that's part of it. I tell people it is what you want, it is what you like,
Right.
it is what you want to emphasize on your figure.
So what do you say if someone comes in and they're going to be ridiculous and they'll be walking around the streets going, "Oh, Dr. Churukian did this," and
Well,
they want these oversized, unnatural looking implants? What
And
do you
occasionally
what
we
do
get
you
that.
do?
Occasionally we get that. So what I'll tell them is really, it is your body. I don't want to interpose my particular tastes on you. However, these are the things you have to know: higher incidence of complications, higher incidence of revisions, and there's essentially a good chance that we're going to have to change them out a little bit sooner for you. So it's, as long as they understand the risks, my job is to present them the risks, and as long as they understand what they're undertaking, they're free to choose whatever they want. But they just have to understand, the better that implant works with their body, the more I can give them a complication-free result.
So you don't worry that reflects badly on your workmanship? Because my concern at Eternal Beauty Skin and Lasers, and we have people who are coming in and insisting on getting products we know will make them look unnatural. I just won't do it. Do you ever say, I don't want to do that? Do you ever say that?
Occasionally you do have to say no to people, and that's, and part of it is you can certainly see when people are going to be unreasonable. My feeling is there are certain patients who don't take responsibility for their decisions.
Right.
And you can oftentimes identify those folks, and those are the people that I'll typically say no to.
That's great, because I'm going to do the same thing here. Because, it does reflect badly. It makes it look like you weren't considerate of how this person is going to end up looking. So I'm happy to hear that. Now, can a patient with breast implants breastfeed a baby?
Yes, and the reason that's the case is that the breast implant is placed behind the breast tissue and behind the muscle upon which the breast sits. So the breast the implants push the breast forward. So as long as the implant isn't too large and doesn't interfere with the with the breast tissue expanding during pregnancy, patients should be able to breastfeed without problem if they could to begin with. Because there are a certain percentage of patients that are not going to be able to breastfeed for one particular reason or another that has nothing to do with breast implants.
Okay. And over time, how do you prepare someone as they age and the body starts changing and north starts heading south? How do you set their expectation in terms of what to expect as the body ages with implants?
So I wish I didn't have to say this, but plastic surgery does not stop people from aging. I wish I had the solution to that, but people will age no matter what happens. So aging will occur normally. Now, what I do tell patients is that at some point, if you do want to just completely remove the implants, your body will typically return to the state that it would have been if you had had no implants. So unless you have really, really very large implants, the tissue is going to contract back to its original state.
Okay, my last two questions and then we're going to move on to the next topic. How long does the procedure last and how much downtime is associated with it?
Okay, those are great questions. So initially the procedure, my operating time is somewhere between a half hour to an hour. Now that doesn't include the time it takes to place the patient under anesthesia, the time it takes them to wake up, and the time we take to place dressings and whatnot on them after the procedure. So in general, what I tell patients, from the moment the door swings in to the moment it swings the opposite direction, it's about an hour and a half. Now, I'm sorry, what was the second follow-up question?
How much downtime is associated?
Oh, okay, downtime. So one of the things that we are really excited about with breast augmentation that we've instituted over the past 8 to 10 years is our rapid recovery protocol. And this is based on some findings by Dr. John Tebbetts out of Houston, Texas. And basically what we tell patients is that we want you to have a normal weekend. You're going to be up and moving around. You don't have to sit on the couch and watch movies. In fact, we would rather you be up and walking about, going to the mall, going out to lunch, going to a movie. Because what we find is when people are up and moving around, not necessarily overly active, the circulation to the chest improves, the swelling decreases, and people tend to feel better. So part of that protocol is also using ibuprofen, which is a non-narcotic. We find that people do best with that drug because it does address the musculoskeletal pain of breast augmentation. Mm-hmm. And breast augmentation is really something that affects the muscles more than anything. That's where the majority of the pain comes from.
Okay. So before we switch topics to the eyes, what have I not asked you that you would like my viewers to know about this procedure, if anything?
Well, I think you've done a really nice job of covering a lot of the concepts of breast augmentation. And I try not to say too much to make people confused. One of the things I will say is that our area here has some very nice plastic surgeons in it who are very competent, who can give them a good result. But really it's all about trusting the person that you go to see. So establishing that bond of trust is really important because there's a very small percentage of patients who are not going to have an optimal result. And you have to trust your doctor enough to know that he's going to get you through those complications.
Thank you. I can't imagine anybody not getting the picture after that, right? So now we're going to switch over to blepharoplasty?
Blepharoplasty.
Blepharoplasty, which is, most people know it as eyelid lift. What is a blepharoplasty?
So to understand what a blepharoplasty does, I think people have to understand what happens when you age around the eyes. So for most people, they're going to look tired and sleepy, or tired or sleepy. So what a blepharoplasty does, it doesn't necessarily make you look any younger, but it makes you look fresher and more alert.
Okay.
So what I tell patients they should expect is that you should expect to look refreshed. You should expect to look like you've had a vacation. You should not look like you've had surgery.
So, but some people need this for medical reasons, because I know a few people where it was actually affecting their vision. Have you ever seen anybody with that situation, or is everyone just doing it for cosmetic purposes that
So
you treat?
I think there are certain indications that are what we call medical in nature, and they have to do, one, with the ability to simply see. So if your upper lids cover the outside of the eyes, they can oftentimes block your vision, and especially your peripheral vision. And one of the comments that people tell me afterwards is that their peripheral vision has opened up significantly. The other issue is a functional issue, and it has to do with the ligament that attaches the corner of the eye to the facial skeleton. As that ligament starts to relax as we get older, and it sometimes proceeds more rapidly with some people based on their genetics, the tear film of the eye starts to leak out the corner of the eye. And what happens with that is you can get dry eye symptoms, and that's that sandy, gritty feeling that people feel when they wake up in the morning, or the sensitivity to wind or smoke, or just a general dry feeling that makes them want to put drops into the eyes.
Okay, so how is this procedure done? Do you have many options? I've heard you can go above the lid or you could go in the brow. And what type of anesthetic is used for this procedure?
So one of the things you try and separate when you're doing a blepharoplasty is you're trying to separate the component of a sagging eyebrow. So if you have a lot of sag in your eyebrow, you then want to do, in conjunction with the blepharoplasty, a brow lift. So what that does is it elevates the brow to its normal position, it reestablishes a normal relationship between the brow and the eye, and then it sets you up to make sure that you don't over-resect skin on the upper lid. Because if you take too much skin, what happens? People can't close their eyes, and if they can't close their eyes, the eyes get dry, and that's a real big problem.
Wow. So is there visible scarring after this procedure?
If you look clearly, or if you look closely at somebody, you will see a scar, but it is cleverly hidden in the crease of the eyelid, and so oftentimes that area heals very nicely, so it's very difficult to see the upper eyelid scar in most people.
Okay, and you've put them out completely for this procedure?
In many cases we do. In some cases people desire a minimal anesthetic, and then we use local anesthetic combined with a deep sedation.
How long is the downtime for this procedure?
So what we tell people is after about 2-3 days, when they're feeling better, you can put on your sunglasses and nobody will be the wiser.
And do you have to leave stitches in that have to be removed? And if this is so, how much time, how long do they wear the stitches before you remove them?
So stitches typically come out in about 5 days. If you've got any residual bruising, it usually takes a week and a half, and in some people who are very thin or fair-skinned, it can be up to 2 weeks.
Okay. And so these, you can hide the bruising and the scars because nobody runs around with their chest hanging out. But with this, it's visible. So how much downtime is a person expected to?
Well, if you're worried about the bruising and you don't want to wear sunglasses or glasses, it's going to take about 2 weeks. In some people, it'll be a week to a week and a half. Typically, the younger the patient, the shorter the recovery. Now, one of the caveats is we tell married couples that they may not want to go out in public together while the wife has bruising around her eyes. They'll get a couple of dirty looks.
Why did you beat that woman up like that? So how do you actually perform the operation?
So the operation is typically performed, again, in an operatory. We usually protect the eyes by putting corneal shields, which are they look like plastic contact lenses. And then we essentially excise skin And if people have some puffiness to their lids, we'll excise fat. And in some situations, we'll actually take that fat and use it to build up other areas around the eye, especially if people are very thin around the eyes.
That's awesome.
In some cases, we won't remove fat, but a lot of it depends on what the person comes to me with, and we design the procedure to essentially address the issues that are concerning to them.
And since it's so much downtime is associated with it, and I know that varies because some people bruise and they go through all different shades of greens and yellows.
Well, I'm gonna differentiate between physical downtime, which is where you are stuck in bed, and what we call social downtime, which is where you just don't want to show your face.
Right.
So social downtime is going to be about 2 weeks.
Okay.
Physical downtime is going to be a day or two. And you're going to feel pretty good. You're going to be able to be up and moving around pretty well after that.
So because it involves that much downtime, would you recommend if someone has concerns with their lower lid, so they combine these two? So you just go through one phase of downtime, bruising, looking like you were beat up? Because I know that a lot of people have the issues on the top and they have too many fat pockets in the bottom.
Mm-hmm.
So would you recommend doing both of those, treating both of those concerns at the same time?
Oh, absolutely.
Okay.
I tell people, if you're only going to remodel half your kitchen, what's the use, right?
Right.
So really the upper and lower lids are a unit. And when people look at you, they see both your upper and lower lids. So if you just do your upper lids or if you just do your lower lids, you're only going to look about halfway there, and I think oftentimes people are going to be disappointed with the end result. So what we try and do is we try and counsel them as to where we think they're going to get the best result and which components to include in their procedures to get the best result.
What type of complications can be? I know there's always things that you didn't do wrong, it's just nature. What types of complications have happened and can happen with this procedure?
Well, we'll start with the worst complication. Now, it hasn't happened to me, and I knock on wood whenever I can, but blindness can occur with blepharoplasty, and that usually typically occurs when there's extensive bleeding. So what the bleeding will do is it will create pressure on the optic nerve, which can damage it. Now, that is very, very rare, and if you know what to look for, it should never happen to you. Probably the biggest issue is that we're going to get a little bit of dry eye with patients, and so oftentimes that's what we counsel them to prevent, and so we provide eye ointments and eye drops. So there are things that are simple to take care of if you're thinking ahead.
So we're almost out of time, and last question is, how soon after this operation can one return to exercise?
So exercise is a tricky question because oftentimes it depends on the individual. Mm-hmm. So the younger they are, the quicker they get back. But typically we're telling people between 2 and 4 weeks. And we start them off in a very graded return to exercise. So listen to your body. If it doesn't hurt, if it doesn't bother you, then you're okay.
Dr. Churukian, thank you so much for taking the time to do this. I have so many friends who've been interested in these two topics, and that's why I've chosen these two. But I'm hoping going forward that you would return to address and answer more questions because you offer so many different plastic procedures that I am trying to encourage them and just have them meet you before they meet you. So thank you so much for coming on my show.
Well, it's been my pleasure. I've had a lot of fun. I hope we haven't scared too many people out there. So
I think on the contrary, I'm sure you're going to make them feel more safe because they are interested. So until we do our next segment, I thank you very much, and I hope that you have enjoyed this and we've managed to answer any questions and concerns you may have with either of these two procedures. And once again, thank you for watching the Jennylyn Show, and I will see you next time. Thank you, that was great.
Thanks. Well,
You're
a lot of
great.
fun.
You're a little movie star, man.
A lot of fun.
You did.
It's easy to talk to you.
Thank you. You're such an actor.